Hello, I'd like to welcome everyone to our Board of Health meeting. It is Monday, February 9th at 6:02 p.m. Um, we'll start with a call to order. Megan said she will be joining us when she is able to. Otherwise, Stephanie Granger present, Joanne,
Aye.
Michelle,
Aye.
and Dr. Gopal.
Aye.
Great. So hopefully Megan will be able to join us soon. Um, I guess our first agenda item is open forum. Do we have anybody? It doesn't look like that's likely.
We do not have any questions or any discussion or hands raised in the chat.
Okay. So then we can get right to the minutes from January. I read through them and I did not notice anything, but anybody else have any comments on them? Joanne, yes.
So give me a second. I'm trying to get to them. Okay. In the minutes. Oh, it was just a couple like typo-y things. For about the hotel motel regulations. I don't know, midway through, Dick proposed titling the regulations. I'm not sure that's spelled correctly, but maybe it could be Dick proposed to title the regulations. I'm not even sure that's a word. Title?
Or to rename.
To rename. Yeah, the regulations. I like that. There was one other thing that I thought that was like a typo. Oh shoot, I don't think I can find it right at the moment. Sorry. It was just another typo-y thing. So a spelling error, I think. That's all.
No one else caught it? I admit I was a little sleepy this morning when I read through them.
Oh,
Um, okay, then do we want to go ahead and approve them with that change and leave our typo in there?
I know. I read it all and you know what I said? Oh, I'll remember that because there's only two little things. And of course I didn't write it down.
I'm sure
So,
the content's all there.
Yeah. Oh yeah. Yeah. It's just like, and I'm not, again, it's just a spelling error, I believe.
so we can let it slide this time.
Yeah.
Okay, does anybody then want to make a motion to accept the minutes?
I make
I'll
a
do that.
motion to
Oh.
accept the minutes as is with that correction and with a possible minor spelling error somewhere that will not overall affect the content of them. Hopefully, given I didn't pick up on it.
Yeah.
Okay, motion made. Is there a second?
I'll second.
Michelle seconds. All in favor. Stephanie, aye. Joanne,
Aye.
Michelle,
Aye.
and Stefan.
Aye.
Thank you. All right, so we're a little ahead of schedule. Should we is Cheryl here?
She is. Yep.
Should we go ahead and just get started on that?
Yep. Absolutely.
Hi,
Uh,
Cheryl. Thank you so much for joining us tonight.
I'm not sure if she's there yet.
If she's there yet, yeah.
I did promote to panelist.
Okay. Hi. Hi, Ray. Hi,
Hi.
board. Hi, Joanne.
Hi, Cheryl.
Hi, Cheryl. Thank you
Thank
for
you for
joining us.
coming.
Yes, thank
Oh,
you.
sure. Not a problem.
Um,
Do you want me to, I mean, I know your board, Ray, has been incredibly comprehensive in the way that they're looking at kratom, however you want to pronounce it. Do you want me to just give a brief description of where I think we are as a state
that'd be great.
on this?
Yeah, thank you.
Okay, and some of this I'm sure you folks already know because you've done the education piece, but um, as most of us know,
Excuse me,
um,
just sorry, Cheryl.
sure.
Um, just so that Megan can be part of the conversation, Madam Chair.
Oh, does she need to be brought in? Okay.
Yeah.
Megan, are you present now?
Yes.
Okay.
Sorry. Thank
So
you.
that's at 6:07 p.m. Okay, there we go, Cheryl. Thank you.
Great. Kratom by itself, the kratom, original kratom, is, as we all know, leaves from a tree that grows in Southeast Asia. Considered part of the coffee family, and they have been used for centuries by folks in Southeast Asia. It is not currently classified as an opioid, but the plant itself can bind to opioid receptors. It is described as not addictive, but because it doesn't produce a euphoric high, it's compared frequently to caffeine, which is, it's part of the coffee family. And it has been anecdotally, and actually there have been some studies done on it that it has been used as an alternative to opioids for pain and for withdrawal symptoms from other opioids, specifically in my experience, heroin. And there was a study done in 2020 from Johns Hopkins, which looked at 87, at those that were using it for withdrawal from addiction. 87% of them reported that it did provide relief from withdrawal symptoms, and 35% of the participants were free from opioid addiction for greater than 1 year. And there have been, I think, two animal studies where with mice and morphine, and it did reduce cravings in animals for morphine. So why are we talking about it now? So what's the problem with it now? We've actually been to this party before with synthetic intoxicating hemp products. So what we're seeing now is adulterated synthetic kratom products. These have very high levels of the isolated kratom compound, which is called 7-OH, which occurs in very, very tiny amounts in the natural kratom leaf. However, it's being produced in labs that are unregulated, and they're adding synthetically produced 7-OH and then other sorts of products that no one's really sure what they are. Or they're just substituting lab chemicals for kratom. And they're being sold, as you folks I'm sure know, as gummies, as teas, as shots, as pills in convenience store, sort of like we used to call some of these products gas station weed. Now we're seeing gas station kratom. And your health inspectors and directors are seeing it way more than we do. And a lot of these products are mislabeled as herbal supplements, natural, and they're completely unregulated. Both the natural kratom leaf is unregulated, as are these synthetic products. So when I took a look at what was being done at the federal level, right now there's no federal ban on any of these products. The DEA has considered scheduling any product that has 7-OH in it as a controlled substance. The DEA isn't distinguishing between natural plants and synthetic products. The FDA has issued alerts and warning letters saying that these products cannot be put into food. So what's happening in Massachusetts in the most recent legislative session? There have been 7 bills filed, 3 House bills and 1 Senate bills would classify anything that has 7-OH in it as a controlled substance. So it would ban these bills would ban all kratom products. 2 of them would regulate the plant itself. No one under 21, behind the counter, those kinds of regulations, and would ban any adulterated products. So those are the bills that are filed currently in the House. And then when we look at what's happening locally, we have 13 municipalities that have either banned it or regulated it. The ones who have banned it are Northampton, Drake, Lowell, Westboro, Marlborough, Chelmsford, Belchertown, Canton, Attleboro, Kingston, and Bourne. And the ones who have regulated are North Attleboro, has a regulation on the books that says it can only be sold in adult-only retail tobacco stores. And Needham says they've banned synthetically derived kratom. Now, the challenge, as I'm sure Ray's explained to you, is I can actually go through a case study because this makes it very easy. Northampton initially just banned synthetic and left natural kratom leaf. They regulated that by making age restricting it, putting it behind the counter, but they banned all the synthetic stuff. What started happening is the health inspectors, it became very labor intensive because the health inspectors would go into these stores where they thought the synthetic stuff was being sold, and they had to look at each product because some of them were mislabeled natural kratom, leaves from the kratom plant. But when they did a little more research, picking the packages apart, they could see that they weren't natural kratom. And what the health director, what Meredith O'Leary discovered, was that everything that was being sold in Northampton was synthetic product. So what she decided is, because of the time that it was taking for the inspectors to go in and actually use a magnifying glass and go through each product, they amended the regulation to just ban kratom. In effect, what they're doing is banning synthetic kratom because that's all they can find in the stores. So that's the case study of what she tried to do and then what she actually did based upon the work that was being done. Needham, their regulation went into effect end of 2024. I have not spoken with them about their enforcement strategies, whether they're seeing the same issue that Northampton saw. I would not be surprised if that is what they're seeing. It's very hard to find plant-based, real, natural kratom, which is what was being used for withdrawal from heroin addiction and for pain management. It was the plant, not this other synthetic stuff that's out there. So I'm happy to take any questions. I think you probably know as much as I do about this, but that's where we are. We have 13 municipalities right now that I'm aware of that have done something. We have many more that are considering it. And we're actually doing a webinar, Meredith and I and the health director in Canton for the Mass Environmental Health Officers Association. And I'm saying for MIHA next month because this is a topic that is on everybody's mind. And, you know, it's really frightening that a 14-year-old can go into a store and get this stuff.
Thank you so much. So I guess, what was I thinking about my question? Now I'm losing it. Does anybody else have a question while I
I'd be interested in attending that webinar if we could get the information for
Sure.
that.
Ray, I'm sure you can give your board members the link.
Absolutely. Yep. Do you know, I did send out the information too for the MAHB training to all the board members. Will they be covering this too? Do you know?
Yes, I will be covering this at the
Okay.
certificate programs. Yes. And we are actually having one in the Northeast this year in Danvers, which we have not had in, I'm going to say 20 years. So there will be one in the Northeast region this year, an additional one.
remembered my question, Cheryl. It was relevant to, I think, one of our last conversations, but because these things are changing so rapidly, are the regulations like we read that Ray shared sufficient to cover like new forms of?
Yes, that's a really good question. And the Northampton regulation has a catch-all, and I don't remember the terms of it now, but Ray, I can send it to you, where it says, and any other synthetically derived new product. But yeah, it has language that
Okay.
would cover, because right, it's whack-a-mole. You know, you just and they did put in language when they amended their regulation, which they just did in October of 2025. They put in that all-encompassing capturing language.
Okay, that's great. Yeah. Joanne.
Hi, Cheryl. Thanks, Madam Chair. I was just kind of thinking about how to go about this crazy situation. Is there a way, or has anybody thought of, instead of regulating it in or out, permitting it with like the caveat of you have to prove it to us that this is a natural leaf in order to get a permit?
Yeah, I mean,
Sort of like the tobacco, like you have to show the nicotine level for your vape products. And if you don't have the certification, you don't get to sell it. So
right.
is there a way to do you understand what I'm trying to get at?
Yeah, I do see what you're trying to get at. And I think if we could find a way to regulate plant-based kratom, we could require a permit for plant-based kratom and require that it only be sold to people that are over 21 and that it be behind the counter and, you know, and permit it. You know, that's what regulating it would be. You know, you could regulate it. The challenge would be, are you be because there are no federal or state regulations on labeling, um, are you gonna be sufficiently satisfied with, one of these companies that are selling what's supposedly plant-based? Are you gonna be able to trust them? I mean, you certainly could make them demonstrate, but I will just warn that the legislature tried to do that with flavored tobacco products. They require a manufacturer's letter that attesting to the fact that their product is not flavored, and we're getting letters that are completely not true from the manufacturers attesting that no, this is not a flavored product. Zin Chill, for example, and then you open it up and you smell it, and it's clearly a flavored product. So, you know, that's what we're stuck with now in tobacco is these letters that just aren't real because, I mean, would you have the retailer attest to it or would you have the manufacturer attest to it? I mean, how is the retailer going to
Yeah,
demonstrate other than through a manufacturer or a distributor's letter that it's natural?
right. It wouldn't be so much through the distributor. It would have to be through the manufacturer. I'm trying to think of a way so that it doesn't, we're not always, as we always do, we're not chasing. So we're preventing it even being on the shelves in the first place, as opposed to trying to remove it from the shelves, which is harder, which is sounded like what was happening in North Attleboro, whoever
Northampton.
it was that, they'd go into the stores, find the product, and then
Well, the
have to do all
product's
the
already
research.
there. The product's already in Westford. It's everywhere.
Right, but see, in this case, if we somehow attached it to a permit with a fee and a fine, like you got to remove it all, and then in order to put it back on your shelves, you've got to show to us that there's no synthetic
Yeah, the
materials.
question is who's gonna demonstrate that?
Right, that was what I was trying to get at. Where would that come from, and what would we need in order to allow it then?
So, I mean, it
And
seems
what
like
do we have as far as staffing to even do this?
Right.
right. That's a big
But
part of the,
and that's what I was getting at. If it could be a submission that the staff could look at, as opposed to having to do it in an inspection and then remove it, and you know what I mean? Like, it is still work, but you would then know that if it was in a over 21, that it would be okay to be there, not you trying to retroactively deal with the problem.
so I
I
guess
was just
my
trying to think
question
it out in my head.
would be, are there any attempts to make this available medicinally through physicians and pharmacies?
Well, there are in the two bills that not on the federal level, at least not yet, but
Okay.
on the state level, there are two bills that would regulate it, that would regulate the plant. And I haven't read the bills, so I don't know exactly whether it would be by prescription only or, I don't know what the bills say. But they would regulate it on a state level, which would be ideal
hmm
if they
So
could
I mean,
regulate it.
if we were to pass a local kratom ban, because that's what we're able to manage, and then at the state level, they allow for medicinal, that would be fine.
You could amend your reg to just to, and I'm sure if it gets passed on a statewide basis, there's going to be anti-preemption language in it. It says you could go further, but you probably wouldn't want to go further. You just want to have them regulate it on the state level, and then you keep the ban on synthetic products.
Okay. I mean, Joanne,
Can I continue, just keep adding to the conversation?
yeah.
So, Cheryl, in all your work on this, has any community or have you found natural leaf kratom, or is like
I
whatever
don't
Freedom
believe
or
any,
whatever
I don't believe anyone has.
has
Um,
it?
there are two associations. One is the American Kratom Association, that has a website that I think, I mean, they've reached out to me, but I have not spoken with them. Northampton has spoken with them, and they say it's almost impossible to get natural kratom from a retail store.
Where does it come from then?
It comes from online distributors, and that they're aware of that are selling it.
And it's the stuff you can get online is not synthetic?
Not, not, no, not all of it, the stuff that the Kratom Association talks about,
Oh,
is natural, um, plant-based product. So
But
I mean, I haven't spoken with them, but they allegedly have a list of the products that people that use this for pain or for withdrawal where they get it. Because you're not gonna withdraw from an opioid addiction if you're using stuff that's getting you intoxicated. It's just
well, that's, I was gonna say, I mean, and this, right, the product that's available doesn't sound like it
it's
has.
there to get you high, the
Right.
synthetic product. And I can just tell you from my lived experience that I have a son who's been clean now. He's been in recovery for 14 years. And 14 years ago, when he was withdrawing from heroin, his sister would take him to Harvard Square to what's called the pit to get the plant-based kratom. And that's how he withdrew initially from it. It really, but now, I mean, that was 14 years ago before all of this other stuff was out there.
Mhm.
and that's where it gets, it's sort of like medicinal marijuana when that first, when all of the discussions were happening and there was like people use this for legitimate
Right.
reasons, if you will. Um, kind of sounds like the same thing. And how do we walk that
Well,
fine line?
it's what we deal with synthetic intoxicating hemp products. It's the same thing. And we now permit adult use cannabis is legal now, the plant with the THC in it. Um, and it's sort of analogous, in that although this 7-08 that's in kratom is not hallucinatory like THC is, but it's a natural plant like cannabis is.
Did anybody have any other questions then for Cheryl on this? Ray?
We do have a question from the audience. When you're
Okay.
ready.
I think that we can take that now.
Diane Wood would like to know how much of a problem is it locally?
I don't think we know. That's the problem, right?
Uh,
Cheryl, what you're saying is that we know it's in our stores because it's
it,
in all, you've found it, right? People have found it in our stores.
yes.
Um, and we know that it's a serious issue and available to kids, and that's very concerning. Um, and there's no current regulation. Is that correct? Anybody correct me on any of that, or is that?
That sounds
It's
right.
not regulated.
Yeah.
It's not regulated. Um, can I ask a question,
Yes.
please? Yeah. Cheryl, we talked about the bills that are sitting in the House and the Senate. What's the likelihood? Like, where are they? Are they gonna, I mean, we're kind of
We're at the beginning of the next
February, like,
legislative session. So, um, it's really, they've been referred to committee. The regulating ones have been referred to the Judicial Committee. Um, it's really hard to say because it's the very beginning of the session, the 25-26 session. So I don't know.
Thank you. Yeah. I mean, I think that I read through, we didn't have the Northampton example, right, Ray? I read through the ones that Drake at Lowell.
We don't have the Northampton.
I can send you the Northampton one, Ray.
Okay, thank you.
I didn't see a lot of difference between any of the ones that you sent. Was there much that I
No, they were probably all from my MAHB's template,
okay. Um,
but I've added the Northampton one.
okay. I mean, I think that personally, from what I've read, researched, heard, and given what is realistic for our town, the best way to provide protection is a complete ban at this point. You know, if people, it sounds like there are ways for people to get true whole leaf if they really need
Yeah.
it out there, that they're not going to find that in the mini marts and other sources here in town. So I don't think we're really closing off anybody's access to a product that would be helping them overcome.
I agree with you.
And it more important,
Especially hearing the Northampton experience.
right? And it's more important to prevent addiction and death or I guess it's, you know, or it sounds like it's really a rapid challenge when this product is used for people often. So that personally, I would be for, you know, probably copying the Northampton language and passing a regulation. I don't know how the rest of the board is feeling.
I would agree with that.
Megan?
Yeah,
I would
I-
agree.
It's the simplest.
I agree. Yeah. I mean, I think that there's also language based on what we read that covers us if it changes and it does end up being regulated. So,
Yeah.
and if that happens, then great. But currently, I don't think we really have much choice.
Well,
rather
and the
get off
other
the-
thing, what the legislature really loves to do is they love to regulate things and then put the enforcement on local boards of health.
Right. So, yeah.
So can I get back to legislature just for another question, just for us?
Sure.
Does it, and you said you haven't read them all, Cheryl, but does it, thinking about how they come up with stuff and then they turn it back onto us, is there the likelihood of it saying, well, we're going to ban synthetics, we're going to allow natural leaf, and it's up to the towns to figure out how to do that? Is that would
That's
be,
where that's where
that's
my
a scary
lobbying hat.
thing.
That's where my lobbying hat comes
Yeah,
into play.
'cause
And we're
we don't
not
want
gonna
that.
we don't want that either. In fact, we have this problem right now with the intoxicating synthetic hemp product bill that the House passed. The Senate didn't, but the House did, that puts the onus on local boards of health to do the enforcement without any money. And we have fought that hook, line, and sinker because that's not going to happen.
Yeah. Well, I mean, I'm with the rest of the board. I think that's the best way to do it is to ban it at this point in time, knowing what you said, Cheryl, and that the only really true place to get natural hemp is online. They're not going to find it here. So,
Yeah.
yeah.
And honestly, even in our phone calls last week, nobody was advocating for the synthetic of the people I don't think that we had
No.
on. It's so
No.
closing it off locally in the stores is not going to really do anything that should be upsetting to anyone who's
Oh yeah, the industry, the industry wants it regulated.
interesting.
Well, it's
It would make
it's not
sense. I mean, if they're legit, right? They don't want
exactly.
all these other people with all this synthetic stuff, one ruining the reputation of a product that could help people in
Right.
taking up the market. So that in and of it, that's a good thing.
Yeah. Well, thank you, Cheryl. I think Ray, it would be great if we could move on this as quickly as possible. So maybe at our next meeting, have a draft ready.
We'll
We
have
can
one
do
ready
that,
to go.
Ray. We can do that.
Yes, definitely. We'll have one ready to go for the next month.
That'd be great.
Thank you, Cheryl, for all your input.
Certainly.
Thank you.
Thank
Appreciate it.
you for everything you do. Bye-bye.
Thanks,
Bye.
Cheryl. Good to see you.
Okay. Thank you. That was, I think, really helpful. So we'll go ahead then next time and make sure that we have a draft regulation using that language from Northampton for sure that covers any future iterations of this that might be in the works so that we try and have that covered. That'd be great. Okay, then if there's nobody else with any comments, we can move on to our okay, are we not having the PFAS discussion tonight? That's been removed.
Correct. So I just wanted to let the board know that the water department did ask if we can continue the conversation to a time to be determined. They're still putting their presentation together on the PFAS settlement funding that the town has received. And we're going to work with them and meet with them directly about what those percentages look like for the funding that the town has received on PFAS settlement funds from both DuPont and 3M.
Great. And Ray, what percentage of the town is on well? We think around 27?
About 27% is on private drinking water wells.
Okay. So yeah, that's really important. Thank you.
I personally don't understand why I'm responsible for my personal well and maintaining it and replacing the pump and preventative maintenance, and I've done PFAS testing on my water, and why should I be taxed any further? Now we're getting taxed on bags of trash and we get no services.
I'd like town water available.
I would love town water. I would love town sewer. I would love not to have to pay extra for my trash bags. You know, you can't have a family of 5 and have one trash can when you can't have a garbage disposal. I think it's an outrageous tax.
So hopefully, yeah, thank you, Ray, for sticking up for that 27% of the town here and making sure we're part of this conversation. And I'm glad that they decided to bring us to the table here. So we will look forward to how that moves forward. And so that brings us to our draft motel and hotel regulations. I saw the change in the title. that I think makes sense.
So yeah, a couple things we did add. Let me just bring this up here. We did change the language for the title. We added the effective date if that's approved from the board. We did listen to both Abby and myself. Abby's out now, but I both listened to the former meetings just to make sure that we caught what everyone wanted for corrections or additions. Looking at the regulations from several other communities, we did add under the bath linen, as Joanne had asked, for bath robes and bath mats. Highlighted that in red. We did also add, I added at the end, let me just
about laundry.
Let me just bring up that page. Page 5, we added the adequate 6.3 under laundry. Adequate laundry service or facilities shall be provided for residents for the purpose of washing bedding, bath linens, towels, and clothes. This was taken directly from the model regulation. Each resident shall be provided access on no less than a weekly basis to adequate laundry facilities for the purpose of washing personal laundry. If access to laundry facilities cannot be provided to the resident, the administrator shall provide at minimum a weekly laundry service. So that way we're covering for both lodging, bed and breakfast, motel, hotel, and rooming and inns.
And there was some draft language on that. That's great then.
Yes, there was. That was pulled from the Mass General Law.
Excellent. Did anybody else have any comments or questions on the regulation as it is?
Thank you, Ray.
You're welcome. It was actually
I checked all the stuff that I was picky about is fixed. I appreciate that very much.
Not a problem. Not a problem. Yep, it was under Mass General Law. Actually, not from hotels or hotels. It was something completely different. But it had to do with like laundry services
Hmm.
for colleges. And so I just pulled that right from there and I said, well, that'll work. So yeah, let me know. We did also look at the fee, looking at again the market basket. Every it's all over the place between $50 and $200. Some of the communities that had several different rates, I did do some more research. I also looked at the food code. So with bed and breakfast, if it is less than 6 units, you do not need a food permit if you have less than six, depending on what you're serving. So, talking with Sam, we decided that it would make it easier, especially with food, if we did 0 to 6 units at $125. That included the fees for inspection time, staff time, admin, mileage, permit costs, etc. Right down to ink. And anything six and over would be $200 for those inspections. That would be in one annual inspection.
It seems reasonable then if you, yeah, you guys feel that that covers your costs and is reasonable in the market.
So it's up to you tonight whether you'd like to bundle the fee and the regulation together as an approval or not approval, or if you'd like to separate them out, and or if you have questions.
Okay, does anyone have questions?
I'd like to make a motion if nobody has questions.
Okay,
I'd like to make a motion to, oh wait, I don't have it in front of me. Accept the, can I just say lodging?
yeah, chapter 11, section 31, draft motel and hotel
Oh,
registry.
was it on here?
Transient lodging regulations. Yep.
I'll have to read it. All right, I make a motion to accept the motel and hotel regulations per MGL Chapter 111, Section 31 for the town of Westford, including the fee structure as designed by the staff.
Anybody have comments or questions? Is there a second then? I'll second.
Oh.
Sorry, Megan. I will second that motion. Thank you, Ray and Abby. All in favor. Stephanie, aye. Joanne,
Aye.
Michelle,
Aye.
Stephen,
Aye.
sorry, Megan.
Aye.
Okay, great. Thank you. Yeah, for all the hard work you guys have put into getting that just right.
So thank you very much. And what we'll do is we'll work on that application and get the fee set and ready to go. And what we'll do is we'll notify the establishments that are here in town about this new regulation. We'll send them a copy just so that you're all aware. And then we'll encourage them to all be ready to go for the March meeting, so that they can, whether it's March or April, so that they can come all together. We'll do it once because, as I mentioned before, we do have to have that one time per Mass General Law public hearing
Okay.
for
They
the
have to,
very first permit.
okay.
Okay.
That sounds exciting. All right. Well, now we're ahead of schedule again. So we have now on the discussion that Dr. Gopal asked if we could talk tonight about the new dietary guidelines for Americans from the U.S. Department of Agriculture.
As well as the next topic, which was a little bit broad, managing stress. I think I wanted to be a little bit more specific in managing stress related to events in the news. So before I talk about both these things together, I kind of wanted to bring these topics up to see if the board wanted to dive into them a little bit more. I'm happy to do so with the nutrition today. But tying the two together, I wanted to kind of make a quick statement, because not only being board certified in family medicine, but I'm board certified in lifestyle medicine. So both of these were very near and dear to my heart and how they affect chronic disease. And as a physician and scientist, I've been trained to look for upstream root causes rather than just treating downstream symptoms. Lately, when I've looked at recurring public health challenges, I'm seeing a common underlying factor that I felt was worth briefly discussing. What I wanted to talk about was institutional trust and democratic stability as upstream determinants of public health and why they matter for Westford. Public health is not just about disease control or inspections. It's about the conditions that allow people to live safely, make informed decisions, and trust the systems designed to protect them. Public health only works when people trust the information they're given. That trust allows communities to respond effectively to outbreaks, emergencies, and long-term health guidance. At the local level, we rely heavily on science-based federal institutions like the CDC, FDA, NIH, and Health and Human Services. They've traditionally provided the independent, evidence-based guidance that informs nearly all our community level work. When scientific institutions are disrupted or publicly discredited, uncertainty reaches communities like ours, and even sound public health guidance becomes harder to implement. Safety, both physical and psychological, is also a core determinant of health. Recent national events, including widely reported civilian deaths during federal enforcement actions, have increased fear and stress for many people. Those stress responses affect mental health, social cohesion, and trust, which is why the Board of Health prioritizes mental health resources, stress reduction programs, and calm, stabilizing communications during times of national uncertainty. Strong democratic norms help protect public health by supporting transparency, accountability, and evidence-based decisions. I find it helpful to think of democracy as a public health infrastructure. When it's strong, communities are resilient. When it weakens, public health efforts become less effective. This isn't a partisan statement. This is a public health one. As a Board of Health, our role is not to follow headlines, but to follow the evidence. That's why at times our recommendations on vaccines or nutrition may differ from recent federal guidance. When they do, it's because our guidance reflects the best available science, physician consensus, and the specific needs of this community. From a root cause perspective, the health of our institutions and the health of our community are inseparable. So, I mean, Stephanie, I'm happy to you and I had talked a little bit about bringing these up, and I just wanted to see if you guys wanted to talk more about them because I do think, I mean, I was looking over and I appreciate Ray putting this new sort of dietary guidelines for Americans. And I try not to make light of things or make jokes where I think things are really important, but I do use humor in medicine and in my life and everything. And I find it really just interesting that if anyone's familiar with a satiric cartoon called South Park, this over a decade ago, they actually made a joke about turning the pyramid on its side like this, the way that it looks right now when they were doing a satirical cartoon about the fad and people wanting, what is it, like gluten-free diets and stuff like that. And so to kind of see this, it really makes me kind of question what's going on kind of thing. And I do think why I made that statement is I think we do a great job, and I really do think it's important, particularly right now, that we are so transparent about this evidence. And there were a couple things I wanted to pull out and speak with Stephanie and give the tiny amount of credit that I think I can give to this. But it's really hard because I think what I'm seeing again with the things that are near and dear to me, like I keep having to talk about vaccines. Now I'm having to talk about this. Like I love those federal institutions like making evidence guidelines and handing them down to thus, and I just don't see it happening right now. What I'm seeing personally and professionally is I feel it's it's agenda driven and not evidence-based driven. And I think that there is an anti-vax agenda that's driving these, and that we're presenting the evidence that shows vaccines are safe and effective. I think the same thing is going on in this particular food pyramid, and that's where we can turn it over, and I can keep that. You can short me up as much as you want, Stephanie, kind of thing. I really don't mean to prattle on. But I think again, for those that maybe don't know this as well, like again, just spending so much time on this, like I can see what's sort of going on here. And I think what's going on is, again, it's not following the evidence of nutrition. I mean, and this argument can be made. I mean, I have many friends that are scientists that worked in the federal government at these institutions, and nothing is always perfect. I mean, I never loved the nutrition guidelines before, with how, probably due to money and the dairy industry, that dairy was a big part of it. I used to use the Canadian food one that has no mention of dairy in it, because you can get your calcium through vegetables and you don't need to promote dairy. I think the agenda that is sort of driving this food pyramid here is the pro keto, the high protein, high fat diets that are out there in nutrition and health right now. And so, just a couple of the things, because you did make it on the agenda, I just wanted it to be a new business to see if you guys wanted to dive into it a little bit. But since we've got it up, where I would point out, I mean, again, I will give, and I'll let Stephanie speak if you think there's any that I'm missing, but I have a hard time giving this anything, because I think it's agenda driven, with icing sometime on the cake that obviously you're not going to disagree with. Like, don't eat highly processed food. Like, that's not like a new thing to this pyramid, honestly. That's not a thing that anyone was advocating for before. So when you put that in there to then try and make me say, hey, there are a couple good things in here, I just have a hard time doing that kind of thing. But I will point out, don't eat highly processed foods. So there are true statements in here, kind of thing. But the one in particular that I had been doing some research on and had been looking at is, I mean, right off the bat, again, like, this is prioritizing protein foods and animal-based foods. And the evidence shows, and the data shows, that most Americans get more protein, get at least the recommended daily allowance of protein, if not more than that. And the evidence also shows that if you get more than the recommended dosage, you actually can have poor health outcomes like chronic conditions. It contributes to cardiovascular disease, it contributes to metabolic disease and insulin sensitivity, and it can damage the kidneys. And that is the agenda, though, of pro keto, is high fat. And people that are promoting this have said that again, like against the evidence, they've said that these keto diets can like make people not have psychological problems anymore, and psychosis. Like, it's really kind of out there, kind of thing. So promoting protein is just really kind of unnecessary. And then again, some of the icing they put here, and another, if you want another little joke and humor thing that I came across shortly after this came out, I mentioned I'm board certified in lifestyle medicine. A big component of lifestyle medicine actually comes out of Harvard. There's a doctor there, Dr. Beth Frates, who's been a leader at Harvard for nutrition, as well as the American College of Lifestyle Medicine. And she jokingly, on one of her social media things, she's like, I fixed it when she took this, and she just tipped it to the side so that fruits and vegetables and whole grains are what you should be eating, and not oils and proteins. And while they kind of, by tipping this upside down or whatever, And they speak to, actually, before they even get to vegetables, they promote dairy, which I think is unnecessary. There's other places that you can be getting your calcium from. But then finally, they do touch on vegetables and fruits. And this is where I've seen from other people and I've seen from the data, while they're saying eat fruits and vegetables throughout the day, the servings that they're recommending aren't even hitting like the bare minimum. And weirdly, actually, I don't know if they almost made a mistake here because their numbers sort of line up with some of the recommendations based on cup sizes and not serving sizes. And so their serving sizes almost match the bare minimum of cups that you would recommend for these, but serving sizes are actually double that. And so like they're recommending 3 servings per day of vegetables, 2 servings of fruit. Like any nutritionist, any scientist is recommending at least that you're trying to get 4 to 6 servings of vegetables. Like let these vegetables and fruits push the meat off your plate is what we always say. And so same thing with fruits. They're saying 2 servings. Traditionally, you're saying 2 to 4 servings, so they're barely meeting that. Again, this is where I think there's agenda and not evidence in this, where they pushed grains way down to the bottom. Like lifestyle medicine, which is evidence-based, promotes whole grains, and the evidence supports having more servings than they're recommending. They sort of like fall in line with it a little bit, like where a little bit more would be good, like 3 to 4 servings. So a little bit more than what they're saying in this one. But what's really interesting in the data is that it's shown that if you keep getting gains if you increase your whole grains all the way up to 7 servings. So 3 to 4
So
kind of a bare minimum kind of thing. So I think that's kind of where I wanted to kind of rant a little bit about it since we put it on the agenda and talk to this. And I'm happy to speak to that, and that's what the stress um, section
yeah,
that was
thank
next. That I think we do a great job with mental health and stress and what's going on with these kind of things right now.
yeah, thank you. I think I guess maybe one of the things that would be helpful is, again, this is a problem. Like for people who have questions about this, what is the simplest thing we can tell them? And I think I would say talk to your doctor.
Yeah. And I do agree with that. And that's another one of those sort of icings that they have slipped in their anti-vaccine movement as well. And that decreases our vaccination rates is when we say, hey, we're not making recommendations, go talk to your doctor. So I'm never going to disagree with you, Stephanie, like on go talk to your doctor, go talk to a scientist, go talk
But
to
yeah,
an
having a
expert, go
recommendation
talk to a nutritionist kind of thing. There's just so many people to talk to. And there are also, again, what we've talked about before, and I'm not trying to get Ray to have to make another website now for like nutrition and stuff like that. But this data is out there, like in reputable sources, institutions, Harvard, John Hopkins, all of those. But yes, absolutely, you can talk to a doctor. It is, though, an interesting, sort of frustrating one for me and the lifestyle movement is actually when I give my lifestyle talks to the public is that nutrition actually we don't get a lot of training on it in doctors in medical school, and there's a huge movement with lifestyle medicine, and again where they put things in this because they talk about food as medicine, and that's the big thing now. We talk about food as medicine because it's so important. And so I agree with that statement, but the prescription that they have here is sort of the incorrect one. And again, all I'm trying to say there is it is tricky. I mean, because you talk to your doctor and like if they're good, they might say, I don't know, kind of thing. And then so it's who's a good nutritionist or a good dietitian possibly that your doctor works with kind of thing. So
I see a couple options. I
yeah.
mean, we could try and make sure. Oh, Joanne, you have your hand up. Why don't I hear what you have to say?
All right, I'm gonna put my hand out. So a couple of things. Thank you for educating us and enlightening us. I I certainly do appreciate that, Stefan. And I was reading through the whole thing myself, and I had some questions about this isn't all of a sudden this is new. It wasn't new. It's a lot of it, but some of it is. Um, Again, where certain things have been placed, whole fat milk. Anyway, um, my conundrum, if you will.
Yeah.
Yes, you should always talk to your doctor about everything. I mean, like if it's a health question, yeah, and but like you just said, we all know, the nurses know that, most of the doctors don't get that education, the nutrition, so I'm concerned to just have that be an answer. It kind of seems like, I don't want to say a brush off, but it's just too general and too vague. Um, And we know that people can't do that. It isn't like you can just call up your doctor when you have a question on whether broccoli has enough calcium in it, or do you need to drink whole milk? Like those conversations don't happen. So is there something?
Do we,
Is there a nutritionist or a dietitian that maybe, Stefan, you could, point us to, or articles that you could point us to that we could put up on the website? Um,
there's like a
People are
Harvard Health plate that we could
Yeah,
do.
people will do their research, as we know, and we want to make sure that we're steering them towards good sites, and they're more apt, at least I would be, to do that than, to sit at my computer and put a question into my, PCP or something, because that's not how people
Yeah.
So yeah,
read.
so I think that seems like maybe one thing we could do is add a nutrition spot on.
Sorry, Ray. I tried not to get one for you, but Joanne, you're right. You're absolutely right. I mean, it's hard to talk to your doctor. Your doctor's also got no time often to talk to you. So, Stephanie, you have one, the heart plate one that you like that I think is fine. The American, again, I love because they're evidence driven. The American College of Lifestyle Medicine, is a great resource. I can find they have one of those plate things as well. I can go back because we're now talking like several years ago when I was doing primary care. I used to steer my patients, like I said, to the Canadian guideline recommendation one, their version of the plate or food pyramid. So I can go back and take a look at that one and see that if I feel like it's appropriate still, and I can pass the American College of Lifestyle Medicine's plate and any other ones along to Ray if you want me to, Stephanie.
Why don't we, yeah, go ahead and submit some to Ray and then she can share those with us. And if everybody agrees, we can put them as a resource. And then the other thought I had was for health education, the department does, maybe we can do a lecture on nutrition and have someone come speak. I don't know, Ray, if there's any opportunities for that.
If you want to send me what links and information you would like on the page, I am happy to make that happen.
Okay. Um, any other thoughts on that? I mean, and on the stress one too, I don't know. We have a mental health tab. Does that have some links to stress relief? And I was seeing some pretty frightening things about, how stress in children at young age leads to a lot of very serious health issues later in life.
Yeah.
And so it is important for people to learn to manage their own stress as parents so they're not passing that on to their children, and find ways to create as stress-free an environment as possible in their homes during challenging times and life in general. So I don't know if we had any of those links or if anybody has any good. We can do some research on that and add that to the mental health probably page, or, as a little stress reduction or
I mean,
something.
it was also, I mean, for me, being the newest one to the board and realizing today that I've been on the board now for over a year when I was seeing some of these patterns. I mean, that was a pattern that I've seen. I think the Board of Health in Westford does a phenomenal job to address mental health stuff on an ongoing basis, kind of thing. So I think that that is great and helps support when times are maybe more stressful right now.
Yeah, so we can do some looking for those, and if we can find them, maybe add a little stress reduction techniques tab or something underneath the mental health collection. Thank you.
You're welcome.
Um, all right, so new and old business.
New and old business. So I just wanted to bring it to your attention that town meeting is March 28th at 9 o'clock this year. You can find all the articles on the town of Westford's website. There are quite a few. So just wanted to make sure that the board was aware of that. I know everything was being finalized on Friday, so I can certainly make sure that you're all sent the final layout of the articles for town meeting as soon as that's available. And the pay as you throw waste program, last week, the assistant town manager, his office provided a presentation to the department heads here in the town about the pay as you throw program. It sounds like it starts July 1st of this year. I did put a link and some information about that program. That is a 35-gallon trash bucket that's going to be provided to each residence household, if you will, here in the community. They have chosen a vendor. It appears, and residents will be able to purchase additional bags that you're able to buy at local retailers here in the community. There is all kinds of Q&A and information on the town manager's webpage. All you need to put in is pay as you throw program. But just wanted to make sure that this board was aware. It's certainly something that's been on my radar with questions and concerns for both, trash complaints, issues, who's going to be dealing with that, who's going to work on that. It certainly brought Mass General Law requires that boards of health have a regulation pertaining to dumpsters, refuse, and trash. So that's something we're looking at for the next regulation, and certainly pulling several communities draft regulations, looking at model regulations, and working with the town manager's office on those regulations. So wanted to just bring that to your attention. I'm not an expert on the pay as you throw program, but certainly wanted to bring, I know there's people that are happy and unhappy about it. And on our end, we're just trying to make sure that we address any concerns or questions or complaints when it comes to trash throughout the community. I don't know if there's any questions on that. And then Ask the Nurse. I just put that in your packet. That is our public health nurse does her monthly presentation, and for WestfordCAT, that goes in their home publication. And so this month it is on heart health for February. We do also have, I had some information on our heart health activities. We are providing, I believe we're almost full for our CPR for both BLS, families, and for any individual that needs their CPR and first aid certification. Fees review, I just wanted to let you know that the town manager's office has let all department heads know that they're looking at fees across the town, and they've asked that anyone who is considering looking at their fees for increases that they hold for the moment while they're pulling in their research together. This year is a year that we would be looking at our fee research and reviewing all of our fees. We try to do that every 2 years. So last time our fees were reviewed was 2024.
That's why it felt really often. I was like, didn't we just do that?
Yeah, it feels like it was just done, but believe it or not, it was over 2 years ago. So I just wanted to put that on your radar so you don't think we're falling behind on that. But they've asked us to hold. I think they're trying to do it more comprehensively. Not sure what that looks like yet, but more to come. Um, Tobacco fines. So I just again want to make sure this board is aware. Um, Typically, we see fines every day for all kinds of things, from tobacco to inspections that we conduct throughout the year. But when it comes to establishments being fined $1,000 each for selling to kids, minors that are underage, they were each fined $1,000. We had 3 establishments here in the community, and they have all paid. So I'm supposed to bring that to your attention, and just wanted to make you aware that they were all re-educated. They were all spoken with and fined, and the fines have been paid. So our tobacco inspector issued those fines, um, and he was the one that was out while the compliance checks were taking place. So he did witness that. Yep.
I had a question, so the fines go up with each time that they fail inspection. There's not like within a year or anything. It's just an ongoing.
So if it is within a year or if it's ongoing, the fees would increase. In the case of these 3 establishments, they have not been fined before with, let me back up. These 3 establishments have not been fined before for this particular violation. I will say too, what can get tricky is a lot of times the establishment name might be the same, but it's a brand new owner. And as you're aware with the sunset clause, they have so much time before they have to renew their permit before they lose that permit. And so they're pretty savvy about that. And so when they're transferring over, it's usually like within 26 days before the paperwork is finalized. So in these cases, these 3 establishments have not been fined previously.
Can they keep changing? Is that a loophole?
Yes, I will say it. I was just going to bring it up. I have personal experience with that.
Is there no way to address that loophole?
There's always a way to address a loophole.
Yes,
and so, yes. And so this has just come to our attention with one of the establishments that there was a previous fine issued for the establishment. But again, it was not within a year. It was over a year.
But does that reset? Does that calendar reset for the fines or not?
It resets for the tobacco federal fines.
And the state?
I'd have to double check on the state.
I can't remember.
These are federal fines that he issued. The 1,000 in the state of Massachusetts, it's also 1,000.
So they would not be paying 2,000 then, or they are?
They are not. They are each paying $1,000.
They don't have to pay the state fine?
Nope, it's one fee. It's one fee. So they don't pay one for the federal and one for the state.
How were they, how was it discovered? Like on an inspection or what?
It was. So it has to be on an inspection. It's a compliance check. So there's inspections that our tobacco inspector conducts throughout the year. We have 20 establishments here in Westford that have tobacco permits. And then what happens is they're also grant funds for what's called compliance checks. And so, they have a child, if you will, if you want to say child, a teenager, go out with them that minor and that is under the 21 and will go out and buy a pack of cigarettes or a vape or some kind of tobacco product. And if the establishment sells to them, they are they're giving a written notice, they're given an official letter, and they're given a fine fee. They'll go in, they'll talk to them about what just happened, and then they'll let them know that they're going to receive a fine in the mail and a letter.
So can that happen more frequently now that in those locations, or do you have to wait?
No, so what they'll do is they do them several times a year. And what they'll do is they'll let me know that they're coming and that they're coming out to do that. But establishments, we don't let anybody know because, they're out there to check.
So if there's a way that we should be changing our regulations to work around that loophole, we probably should be doing that.
Yeah. The tobacco regulations were just updated for the state, so that is also something on our agenda to look at them, not just for the loophole, but to make sure that, we have them up to the higher standard right now.
Okay. Thank you. Let's
Sure.
add that to the list.
Yep. Add it on.
Excellent. Okay. Employee wellness.
Okay. Employee wellness, just wanted to let you know that we have just rolled out a program for employees, kind of a taste. It's a 5-month taste. So you each month is an opportunity to try something new, pickleball, different kinds of things, Pure Bar. We're working with vendors here in the community to offer a little taste session for employees if they're interested. So that's taking place right now. We just finished our, here at the health department, we're responsible for employee wellness. So we do make sure that we check with all the vendors in the area, everything from massage to gyms, for any corporate discounts that they might offer other corporations that are offered to our employees. So that is going to be rolled out early next week. So just wanted to bring that to your attention. Staff updates. Our assistant director, Abby Graham, is not here this evening because she did have her baby girl. So we're super excited for her. She is doing great. And so she will not be back until the end of May. And then she'll be here part-time June and July. So we do have a couple of people out for school vacation week that's coming up this month. And just wanted to make you aware that I know, everyone seems to know someone who's got some kind of illness. So we've had a lot of staff out, but making sure there's coverage. So just wanted to update you on that. Emergency preparedness supplies, working directly with our fire and emergency services here. We have the health department's just ordered the town some additional emergency preparedness supplies, excuse me. And so those have just been delivered. We're building some new linen kits, and we've ordered additional blankets for hopefully we never have to use them for emergency shelter. And so just looking at some new products, bracelets, things like that to match people up with their pets. God forbid we ever need to provide a pet shelter. So working with them closely, we are working with a vendor right now to build a tabletop for all departments to be part of an emergency plan here. And we'll update you when we have more information on that. And the last item I think is the draft town report. So as you know, each year as part of not only the budget and the budget narrative, there's also the town report, and that is part of the Board of Health's charter. So attached, you'll see the town report draft that we put together with a little kind of synopsis, accomplishments, goals, things like that. And then we do have all our metrics in there for both inspections and communicable disease. So if you have any questions, let us know.
Yeah, I thought it looked great. The only question I had was whether you need to say something on the communicable disease and such, indicating that you're tracking these, but many of these, it's only as good as the reporting, right? So we know that a lot of those things are very underreported.
Yes, so we do have, originally when it was in a paper form, there were additional items that were added. The town has a brand new Capital Solutions is what they're called. It's a communications contractor that is putting this together in a different format this year. And so some things due to space have been taken out, but we can certainly see if we can add a caveat. But you'll notice we have probable and suspect disease.
Yeah. But still, I mean, clearly flu and COVID and, so many of those just don't get, you have no clue. It's neither probable nor reported because it just goes on.
Right. And we did have a lot of questions actually at the finance committee about the metrics for some things they wanted to see. For instance, they had a lot of questions about the opioid related death, where that information comes from. And I will say the information here comes directly from our police department. I would love to see, for instance, suicide. We're in the middle of a project right now to find out what people are living and dying from here in Westford. What are people dying from for mortality? So we're working with an epidemiologist in a project here on that in the background. But yes, I do agree that, and as I said to the finance committee, there's over 90 communicable diseases. We're just putting in what we're seeing numbers for, but certainly, yeah, I agree with you. So we could certainly put in
Some of them, are reported directly from doctors when, and those are the more serious things. But on a lot of the things that doctors don't know about, you guys aren't knowing about either.
like foodborne illness. Nobody's going to the bathroom if they're sick and stuck in the bathroom, right? They're not getting a stool sample.
Right.
So the numbers are off, right, for a lot of
They
things.
may call you if they're wanting to report it because of the place they ate, but otherwise, probably not. Joanne, you have your hand up, and then Stefan.
Yeah, that's a good place to stop. No. Anyway, I was very impressed, Ray. I mean, it's very comprehensive, and I appreciate all that work. I do have one comment. I don't know if this is a draft document or if it's done, but I noticed and it's all in the beginning. I think it's on page like 1 or 2. I have to pull it up so I could see it. When describing, I think may have been under the health department. You said it's written as emergency prep. You should write out emergency preparedness, and then later on in that same page, it's you work with the fire department, on the EP plan. People are not going to know what EP is, so
Okay.
just some acronym stuff. There was a reference to CHIP because I think in some of the goals it said, as per the strategic plan, which I'm assuming is the Westford strategic plan, but I'm not sure if it's for the Westford Health Department or the town. So you may want to, again, clarify that a little bit. Or you can, if you write it once, like you did, I think for the public health nurse, you put public health nurse parenthesis PHN and MRCE, that was the way it showed up later on. Then you can use the acronym. But I think emergency preparedness is too important. I think you should write that out each time. People won't know what EP is. So
I'll double check too to see if it was cut. If they cut it to fit, because typically we always, how public health is, we're acronym crazy, right? And so you need a Bible just for all the acronyms. And so,
well, that's what I was thinking.
I'll double check. Yeah,
you just get used to always doing things in acronyms. So sometimes you're just doing it and you're not thinking. But double check. And
I'll double check.
Yeah, and I don't know. I still think that would not be a good. I mean, unless you could do, write it out. EP equals emergency preparedness parentheses EP, and then you could use the acronym. So anyway.
Okay. No, thank you. Good point.
Stephanie,
no one's going to know what CHIP is. So yeah, I don't know if you want to write that out or not, but
yeah, and I believe it was
chip in the jar.
Yeah, but I will double check.
Yeah, okay,
I'm not even sure I know what it is.
What CHIP is?
Yeah, is it child health?
Community
health improvement plan.
Yeah. Oh, that CHIP. Okay.
Yeah,
there's another CHIP too.
And then there's the char.
Yeah. I'm thinking chocolate chip cookie. No, sorry.
Yeah, there's that one too.
No, we can't eat those.
Dr. Stefan.
I was just curious again, like how you were saying a lot of these diseases are obviously going to be underreported, but in particular with like the flu and COVID, when they are tested in like a clinic or like urgent care on a rapid test, like do you get all of that from those clinical places? Do you go asking for it? Do they volunteer some of it? Or is even all of that like what percentage of that is missed that
Most of it.
someone knows and it doesn't even get to you kind of thing? Because I know there's tons that no one even tests kind of thing, but I know the clinicians and the urgent cares run those rapid flu A, B, and COVID tests like all the time, and that's not necessarily funneled to you.
No, it's a little bit of a hot mess. I'm not going to lie to you. Same
It
with
doesn't
COVID.
surprise
When
me.
we were,
It doesn't surprise me at all. I was just curious how hot and how messy.
So I think that was my concern, that somewhere we needed to indicate that, aside from the ones that are, like when my son had shingles at age 7 and the doctor was like, we didn't have an appointment. And she's like, okay, I have to make this an appointment because I have to document this and, report it. Um, Unless it's the things that have to be reported in, those
Mandatory.
numbers are,
yeah,
yeah,
you almost need a disclaimer,
right.
right?
That this
You
is
you
not at
could.
all
Based on
representative.
the Maven system spelled out,
Yeah.
right? Spell out Maven,
Spell me.
then put
Yeah, because
Maven,
everything
and
comes
then
through Maven, Stefan, and know that they're not reporting all those rapid tests. That was always our problem with Lyme, but there are certain
I saw 0. I'm
there's
like, there's no way there are 0 Lyme disease cases in town in a year.
well, Lyme is something that is supposed to be reported by the physicians if they're doing the blood tests. There's certain things that can only be diagnosed through a blood test, as you well know, so that would come through Maven through the lab. There's required reporting that way. But something like Lyme, if it's a clinical diagnosis, there is a reporting process that a physician is supposed to be doing.
But there's no way Westford had 0 Lyme cases in a year.
right, there's probable cases. And, just like food, you're going to come in and they're going to say, look at this rash. I think I was bit by a tick. And they're going to say, okay, well, let's put you on a round of doxycycline just for preventative. And they may not do a blood test. Just like you come in your stomach and you have diarrhea and you have this, and they may not test you for foodborne illness. Um, so, yeah.
If that is though, like with the mandatory reporting ones like STIs and stuff like that, where it's the not the physician at the clinic that ordered the test, but I found this out in my growth as a physician. It's like the lab
It's a
is
lab.
the one that's required to do it. I'm actually really then surprised that they don't have any positive ones for Lyme because I mean, I know people come in like asking for that, and there's no way like that there's not like a lab blood test that hasn't come back positive like at I wonder though, does that fall outside of like how do they correlate that? Because if that lab test is done at Emerson Lab in Concord, does that still come back? Is there any, or is that completely off your bucket then? Because the test was in Concord, even though the person that had the test was in Westford. And I
It's
don't mean to get into the minutia, but there's that kind of stuff that interests me a little bit.
so the Maven system, it that's our electronic reporting portal. Everything is reported to the town where the person lives. So it's
And
not where you test.
It is where you live.
It's where you live.
so
So
that's
it's not
crazy to
showing up.
me then too,
So
Stephanie.
you could be tested in,
Zeros.
yeah, if you're visiting Montana and you
Yeah.
get tested and you're a Massachusetts resident, Montana would then report it to Massachusetts, who would report it locally to us, vice versa, the same way. State to state, we don't do state to state, the states do it. Maven doesn't talk to other states, which is a whole nother thing. But if you're tested, in Pittsfield, it's going to show up in the Maven system for Westford because this is your place of residence.
Yeah.
So we're not missing people that way.
They're just not getting into the system.
It's, there's whatever the number of reportable diseases, and some are reported um, strictly by labs because that's the only way you can diagnose whatever this situation is, and the lab has mandatory reporting, and some is reported directly from physicians. So,
And if you ate if you live in Chelmsford but ate here in Westford, we wouldn't necessarily know.
Unless it gets reported.
Correct.
Then we do, yeah,
We don't
do
have
town to town,
access to see other communities.
So they
unless we
could
get
have
access.
for a-
We can, if we get access, if we share with other towns, which,
If we
you
share
know,
it.
on outbreaks and things like that, we do share. But Chelmsford would call us. I mean, there's a system in which we work together as, you know, communities. But it wouldn't show up in, you know, the Maven system if it was a Chelmsford restaurant. Only if you're a Westford resident.
I don't know. I just know that clearly those numbers are not 100%.
Oh no,
And I actually know
clear,
somebody
for some things
had,
they are because of the way it's reported. For
well, I
other
know
things,
somebody who had
clearly not.
latent TB and never had follow up because I don't think the town was ever notified and they lived in town. So it happens, unfortunately. And that was why I was just like some sort of caveat to indicate that this is our best set of numbers, though we know it's not complete.
Yeah, through the system where we get notified.
Yeah.
The other thing is too, there's a lot of work that's done on cases that are then revoked. Because you have to. If it's a measles case, you have to do the initial, you know, work in case it turns out to be positive. It happens a lot with mumps. So there's a lot of work that Gail is doing that doesn't get reported necessarily because then the case gets revoked after the fact, and then it just stops. But she's been working. And usually it's things like measles and mumps and meningitis and things that are scary, which is, you know, stuff that you have to get working on right away. So
Yeah. But it looked great, Ray. I thought that looked terrific. Really impressed.
Yeah, I'll see
Yeah,
if it's
awesome.
not too late to add the disclaimer and to I'll double check on some of the wording, the acronyms.
Thank you. And that brings us to the end of our meeting.
It does. I just wanted to let you know that one of the questions in the Q&A from Diane is she wants you to know that there's a forum tomorrow at the Cameron Senior Center on the Pay As You Throw program. If anyone's interested.
I've seen that. Okay, then we can go ahead and have a motion to adjourn.
I'll make a motion to adjourn.
Motion made. Is there a second?
I can second.
Megan seconds. Thank you. All in favor, Joanne? Stephanie, aye. Stefan?
Aye.
Megan?
Aye.
And Michelle?
Aye.
Y'all moved around on my screen, so change in order. All right. Thank you so much, everyone. Have a
Thank you.
Thanks.